So I'd like to introduce our first witness, and it's Mr. Jim Fetzner. He's the CEO of Comfort Care and Resources in Erie, Pennsylvania, my hometown. Mr. Fetzner is working on service innovation and healthcare IT initiatives in his company. Founded in 1997, Comfort Care is a home-based long-term care provider that offers flexible, cost-effective solutions so that elders may live in their homes regardless of physical and social needs. Welcome to Washington. Thank you for being here, Mr. Fetzner.
Thank you, Chairwoman Dahlkemper, Ranking Member Westmoreland, and members of the committee for allowing me the opportunity to testify today regarding healthcare information technology and Title 13 of the American Recovery and Reinvestment Act of 2009. I consider it an honor to be a part of the process of moving our healthcare system into a new and critically important generation of technology and service delivery. My name is James Fetzner, Chief Executive Officer of Comfort Care and Resources. Currently, we serve 3 counties and hundreds of patients, enabling them to age in place. Our company was started in 1997 by my mother, Beverly Fetzner, with only a pager, a passion, and a belief that there is nothing that is done in a nursing facility that cannot be done better at home. At that time, and unfortunately still in some places, this philosophy is a radical idea. However, it has informed my vision as CEO. As a result, we continue to push the forefront in long-term care, working with multiple technology incubators, university centers, state departments, and local agencies. With these partners, we will create an integrated and interoperable HIT-enabled service delivery system that will drastically reduce the cost of long-term care. It is from this perspective as an entrepreneur, not as a clinician or a practitioner, that I offer my testimony on HIT. While Title 13 makes mention of additional settings and is intent on facilitating standards for these settings, the clear emphasis and investment is focused on the adoption and meaningful use of certified EHR. While this is certainly necessary, it is not sufficient. Meaningful use will not be realized until new high-value information is incorporated into workflow and decision-making. When a cardiologist can see a trend analysis for daily vitals of a congestive heart failure patient living independently at home, that is when meaningful use will exist. This type of meaningful use does not occur by investing in certified EHRs alone. This occurs when an entire provider network is connected and coordinated around that patient's plan of care. For information to be delivered to and from the front lines of care in our homes and communities, a seamless ecosystem must emerge. Enterprise integration will be critical, as information will need to pass to and through multiple providers. Providers such as skilled home health agencies, non-medical home care agencies, area agency on aging case management, and others will need to utilize and contribute to that information before it comes to rest in an EHR at a primary care physician's office. Additionally, triggers and alerts will need to be designed for each individual patient to now allow anomalies to jump out from the steady stream of data that will be created. If we simply digitize the information that currently exists through EHRs, the margin of value from HIT will be limited. Significant value will be achieved when new, high-value information can be delivered, assimilated, and leveraged for clinical and operational decision-making. The most valuable information will be delivered from the front lines of care, where we did not have access to it before, from our nurses and from our nursing assistants. This is more challenging by the day, as the front lines of care are becoming dispersed and disintegrated. Nearly every person's home is part of the healthcare system at some point, and the home's role will only increase with cost containment measures requiring earlier discharges and less institutionalized care. It is clear to me that if we look to the future of the healthcare system, the entry and exit points will no longer be our hospitals and doctors' offices, but rather they will be individual homes. Whether that be a patient utilizing the internet to check and update their personal health information, or a client for whom we monitor and deliver information to their doctors and families, the starting point will be home. Therapy, recovery, and end-of-life care will continue to shift towards home to match patients' desires in a more cost-effective, high-quality way. With advances in technology, we can confidently move forward to redefine the healthcare system, knowing that the past insurmountable problems of time and distance will be overcome. No longer will patients need to adjust their life to fit our healthcare system, but rather our healthcare system will conform to each individual. For long-term care, this will mean the long overdue deinstitutionalizing of seniors. I am honored to be a part of the solution, and thank you for your time, and I look forward to your questions.